Hi, everyone. Welcome to Chicago Autism Network's virtual parent workshop. Tonight, we are excited to hear from the phenomenal music therapist, Alyssa Stone with Dynamic Lynks, and we will turn the time over to her.
I will unmute myself so you can hear me because I went, yay, but you couldn't hear me. So hello, everyone. Very excited to meet you. For those that might be coming on after Kimmy's announcement, we are recording. So if you have questions that come up, please write them in the chat so we can keep things private, because we will be recording this and posting on YouTube for future viewing and people to learn about music therapy, which is wonderful. And then we will definitely do a Q&A at the end. So we'll stop the recording. Happy to unmute and dialogue with all of you. But as Kimmy said, I am Alyssa. I am a board certified music therapist. And if you don't know what that is or you've never heard about it, don't worry. You're going to find out tonight. My goal tonight is to give you at least 3 tangible strategies you can use at home to help support someone with autism in your life around the things that we specialize in and focus on at Dynamic Lynks. So I will share my screen so you can see a little PowerPoint, and then I will send a PDF of these slides to Kimmy. So if you registered for the event, you will have a copy of these as well. So we're going to jump right into what is music therapy. Yay. And I have a little video just of our space as well. And so you can kind of see some of these instruments that I might be referring to, kind of how we structure the room and set our individuals up for success. Sorry, I started playing a little too soon. I wanted to make sure the sound was shared. So I'll play this. It's just a few minutes and I'll fast forward a little bit as needed, and then we'll jump right into all the strategies and all the good stuff.
Therapy company who has proudly been serving the greater Chicago area for the last 5 years.
6 years. It's an old video.
Located in Oak Park. We also offer in-home services as well as telehealth services to meet the changing needs of our community. We specialize in the treatment of individuals with developmental differences, mental health needs, and communication disorders. All of our sessions are led through music and movement. We offer both individual and group music therapy sessions, unique social skills groups, as well as traditional and adapted music lessons. We can't wait to show you more of what we do and take you on a little tour. So come on.
Aloha, hello. Hello. Aloha, kako. Nice. Kako. Kako. Good. Hello, my friend. Hello, my friend.
Welcome to our waiting area where you can sit comfortably when your child is in session. Oftentimes,
fast forward through our waiting area. That one's kind of boring.
And I am courageous. Ooh, and I can be even when they're hard.
Welcome into the Tween and Teen Room. This is where we conduct our individual tween and teen music therapy sessions. Whether you're working on anxiety reduction, self-regulation, executive functioning, attention, you name it, we do it in here. This is also one of our lesson rooms, so we offer traditional and adapted lessons for individuals of all abilities. As music therapists, we have the unique ability to access education for all. So that's comprehensive music education from a therapeutic mindset.
Keeping a beat, keeping a beat. We're just keeping a beat, keeping a beat, keeping a beat. The beat until we stop. Are you ready for your first beat, Nate?
Yes.
Do, ta, da, ta, do. Play it with me now. Do.
The next stop on our therapy room tour is our group music therapy space.
So that's our group space. I'll fast forward to the next one. You don't need the whole spiel on every one of the spaces, but I love these examples too of kind of some of the things I'm going to show you to support someone you love in our groups that might happen in person as well.
Hey, Alyssa, someone said the volume is a little bit low on the video.
Yeah, the volume unfortunately is low. Here, I'll turn it up a little more.
Okay,
That might be the
thanks.
best I could do. I'm so sorry.
No, it's fine.
Yeah, I'm sorry, everyone. It is on our YouTube channel as well. So I'm happy to, and it'll come in the slides so you can really pump it up.
Oh yeah, I love it, James. Let's stomp it.
The last stop on our tour is our low-stim individual music therapy space. This is for our younger children who are receiving individual services and might need a little more support, a little more concrete boundaries to work on.
Perfect. I wanted to pause there because it gave you a little sense of what our spaces look like, where we operate, and some of the instruments we use, and some of the strategies you might see and learn about today. Like I said, I will share the link to that as well. I apologize that the volume was low. As I was listening, I was thinking the same thing. So I will make sure that gets sent out if you're interested in seeing more of it. But before we jump into all those strategies, one of, I think, the most misunderstood things, and the title of this presentation is, what is music therapy? We get a lot of individuals coming to us for music therapy services because they have an affinity and love for music, and that's wonderful. That is the first step to connecting maybe with your music therapist. What we'll see here too is that you don't have to especially love or gravitate towards music therapy for it to be a beneficial therapeutic medium for yourself or for others. So music therapy, the long definition is here on the screen if you so desire to read it, as per the American Music Therapy Association. But the definition I give that I think clarifies it is, we're using music to work on non-musical skills. So we're using the therapeutic medium of music, which includes rhythm, melody, harmony, timbre, which means the different sounds and pitches of instruments. We're using the mechanics of music to support non-musical functional skills that persist over time and benefit our clients in a positive way. So it's not teaching music. It's not therapy to learn music. It's using music as the therapeutic medium. So I think sometimes that gets a disconnect in there. Whereas, physical therapy is to work on something physical. Occupational therapy is to work on functional skills around occupations and daily living. Music therapy is doing some of those same skill work just through music. Another misconception I hear a lot in music therapy, and when I tell people what I do and I explain it, they get really hyped and they love what it is. And they're like, oh my gosh, that's awesome. That's so cool. I've never heard of that. It must be new. It's not new. The earliest documentation of music therapy appeared in 1789 in a magazine titled Music Physically Considered. So that's the first print documentation we have of music therapy. And all through the 1800s, we had a lot of examples of medical professionals and psychologists using music and doing music therapy research, which kind of pioneered our entire field of music therapy. It gained support in the 1900s, much like psychology was becoming more widespread and mainstream, specifically in the 1940s, after the World Wars. For people who are coming back with post-traumatic stress disorder, with injuries, there were a lot of musicians in hospitals, and they were seeing on site that benefit that music provided, music therapy specifically when done with a credentialed professional, how it benefited the individuals. So it's not new. It's been around a long time. Our first program was established close by at Michigan State University in 1944. And now we have over 160 universities who teach music therapy, are credentialed certified providers of the music therapy curriculum across the US. And there's even more across the globe. Just every country kind of does things differently. And if you're wondering, who is this person who's supporting my child, someone I love? How do you become a music therapist? The biggest misunderstanding I also find, so that's why I put this in here, is to be a music therapist, you do only have to have a bachelor's level certification. However, I just want to emphasize that's truly 4 years of course study in music therapy versus a master's degree, which might be a more shortened period of time after undergraduate coursework. In addition to those 4 years, we do clinical practicum rotations. And after the 4 years of coursework, we have to sit for 1,040 hours of a clinical internship to sit for our board exam to become a board certified music therapist. So when someone has this credentialing, they really have the knowledge and expertise to deliver what you're expecting from a music therapist. And I put this in here more as an advocacy thing for us and to tell you why I might be able to help you help someone you love at home, because we really have the knowledge and extensive training. In addition, we do have master's degrees, we do have PhDs. I might have some of those and be on the way to other ones, and we have peer-reviewed journals, and I love all that stuff. So if you're thinking after this, man, I need to find a music therapist, this is what you want to look for, and make sure they have MTBC after their name because they've gone through all of these steps. So that's some of the boring stuff. Let's get into the fun stuff. I sing a lot because I'm a music therapist, so get ready. We're going to make some music. You don't have to do anything, or you're welcome to sing along a jam at home if you think this might help someone in your life. That's what I'm here to do, is teach you tangible strategies and skills that you can use at home. Now, who is music therapy for? Who might this be appropriate for? The great thing about music, I think music therapy can benefit everyone. We work with children 0 to 18, adults, older adults, middle-aged adults, elderly, both with and without disabilities. You'll see music therapists in end-of-life care. You'll see music therapists in hospice. You'll see music therapists in psychiatric facilities. We're everywhere and anywhere where someone can benefit from services that target a very wide domain of areas of need, which we'll explore. The reason why you might seek music therapy or want to use this modality for someone that you love is because it is special. Music therapy is different than everything else and might provide a connection that that individual might not have anywhere else. And that's wonderful. We love that. When someone says, my kid just loves to make music, they sing all the time. Oh my gosh, well, do we have some tools for you? It's a part of most people's everyday life. Very rarely, I want to say if ever, have I met someone who doesn't like music, right? Who doesn't have a positive relationship with some sort of music. They may not have liked learning the recorder in elementary school, and that's pretty valid because it's not always fun for everyone, but they definitely have a favorite musician or a favorite style of music that they gravitate towards. It's part of our everyday lives and part of our human connection. One of those things I saw so strongly during the pandemic was the emergence and explosion of TikTok. I personally am old and don't have TikTok. I call it the TokTiks. But music became such a medium for connection and self-expression. And I think we're only going to see that continue. And we use that in a therapeutic way to facilitate that functional change. So it's something we have this inherent connection with that can be used for many goal areas that we're going to talk about. And it brings most people joy. So the reason that is important from a neurological standpoint, if you saw at the beginning, I'm a neurologic music therapist as my additional certification and training. I study neuroscience informed approaches and how music affects the brain. So I'm looking at how music is rebuilding, developing, and repairing neural pathways in the brain, how someone might have damage or different wirings of the brain and need support to rebuild, develop, and repair those neural pathways. And I'm looking at how music affects those neural pathways in the brain. So those shared networks, extended networks, specific areas of the brain, and how we can use those elements of music to accomplish those goals over here. And one of the ways that music can do that for us, and one of the ways you can absolutely use music as home, is to facilitate that joyful engagement and connection, because it is releasing those neurotransmitters in the brain of dopamine and serotonin. When we're having that joyful experience, we're having that release of those endorphins and neurotransmitters that feel good for our body. And when we have that inherent joy and we have that engagement and connection, that sets the base for skill development as we scaffold up. So it can lead us to purposeful engagement and connection, communication and reciprocal exchanges, scaffolding up levels of play. If you start with joy and you start with engagement, you're building regulation and attention to build up those building blocks next. So if you have a child that you're trying to build that relationship with and build that connection in a difficult moment, that joy can really set the framework for everything that you want to scaffold up to as well. I know I've thrown a lot of words at you. Sorry. It's play-based learning. So it's a natural and organic means for therapy is kind of how I like to say it. And I feel like that organic and natural, those words get thrown out there a lot, but we don't have to say anything to do the thing we want to accomplish, which, how do I describe this? Instead of saying your turn, my turn, I take a drum, I place it in front of me, then I place it in front of you. And it's a natural and organic way to build that relationship, to build that rapport, and to build that shared engagement in a play-based way that's still child-centered, but structured and effective to scaffold up the goals we're looking for. It has inherent structure, so I don't necessarily have to create all of these outside structures. I'm using the music to structure the expectations that I want, which I'm going to teach you as well. And one of those things is gestalts. And as much as I'd love to get into communication and gestalts too, I'm sure some of you are hearing that word and you're like, ooh, I've heard about gestalt language processors. Music inherently has gestalts. And one of the things I'm going to teach you for communication today might be really appropriate if you happen to have a gestalt language processor in your life. And finally, as I said, it accesses multiple brain areas. So there's this myth that creative people are right-brained, logical people are left-brained, music is a right brain thing, logic's a left brain thing. That's not true, but there are elements of music that are lateralized in our brain. So there are some things that trigger the left hemisphere more than the right, and vice versa. So if I'm trying to facilitate a skill that is impacted in one of those areas, I know what musical element to use, and I'm going to teach you some of those strategies today too. So some of the goal areas that music therapists work on, I'm just going to pop them all in. Nope, I went too far. Are cognition, communication, motor physical skills, social emotional skills, sensory regulation, mental health, relaxation, self-expression. So many things that we can use because the medium is the elements of music that allow us to do that. Now, every therapist is going to specialize in something different, just like a traditional therapist might, a social worker might, a speech therapist. We're all going to have post-grad level training in our specific area. But these are some of those general categories that music therapists work on. And the three we're going to focus on today are the ones that I get the most referrals for. So I suspect some of the parents, caregivers, people on this call are looking for tips and tricks for these areas too. So we're going to focus on cognition, communication, and then sensory regulation and co-regulation. Cognitive, you might be thinking, what is that going to be? Well, let's jump into that first. To break it down simply, because I'm not going to throw all of the very heavy therapy lingo at you. Generally, we might use music in a music therapy construct to learn new information or retrieve previously learned information. So if I'm working with an individual who has suffered a traumatic brain injury or a stroke, they've had information before and I'm trying to tap into that. And we do that through a technique called, there it is, musical mnemonics training. So musical mnemonics training uses mnemonic devices embedded in music to help store information in the brain more easily, to encode it for quick retrieval in the future. So I should put those up on the screen. So a music therapist is going to structure really specific exercises with all those elements of music we talked about, rhythm, melody, harmony. It might be a little more complex than what you do at home, and that's okay, but you can still use this strategy for some different things. So I'm going to play you an example of what a musical mnemonic device would be. And you all know a musical mnemonic device. We're staying muted, but I guess you could drop it in the chat too. When I'm doing this presentation, I usually ask people, what is the 11th letter in the alphabet? So if you want to drop it in the chat. I had to count it. What the 11th letter in the alphabet is. Yeah, great. You all rock. You're really fast. Now, if you want to also drop in the chat, it is indeed the letter you're saying. I won't give it away. How did you find that letter? What strategy did you use? Counting. Yes, you counted. Oh, you just inherently know that J is 10. Oh, you're thwarting my theory here to prove it. Did you sing a special song to retrieve that counting? Using the alphabet, maybe? No, that's okay. I like that you just know that J is 10. Nope, no song. Wow, so interesting. I have never had these responses before. Interesting. So most people usually tell me they sang the song A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. So you usually go A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. Now that's very specific because I asked you to retrieve a letter, which would be unchunking the chunk that you learned. But most people learn that musical mnemonic device of ABCs, the ABC song. So yes, very interesting that no one said the ABC song. Maybe I'm gonna have to start making a new example. So we use non-musical information chunked into music to sequence and organize that information. So this word gestalts gets said a lot. Gestalts are something, for communication, it looks a little different. For memory encoding and cognitive retrieval, it's chunking information that's familiar into the brain so we can store it more quickly. And that's how our brain likes to perceive things. It doesn't perceive the pieces, it perceives the whole. So we retrieve the whole. So I did ask you to retrieve a piece of the whole, which is probably why your brain didn't take you there. It said, I don't want to sing the song, I want to count. A jingle from an ad was a question in the chat. A jingle from an ad is intended to get that stuck in your head. They are thoughtful about how they do it. So they're using the musical elements to encode it in your brain. I would suspect that the jingle from the ad is going to be more association with the visual versus just the auditory, because it's usually a multimedia format. But I'll give you an example of how I might do this. Sweet, someone did the song. Thank you so much. Thank you for making me feel better. Don't worry, I never take anything personally. So I use this structure of keeping information simple, using gestalt patterns to encode information in the brain so we can retrieve it. So one of my favorites is a shoe tying song. So you keep it very repetitive, you keep it in a small interval, and you sequence it so it's easily stored in your memory for future retrieval. So I'll teach you my shoe tying song. If you have someone who's learning the steps of shoe tying, awesome. A music therapist can make any song for anything through this technique, but you could also do it at home. Just a simple song that's repetitive. And I'll show you how it's done first, then we'll talk about it. So my song goes over, under, pull it tight, two bunny ears that look just right, around the tree and through the hole, pull it tight, and make a bow. And usually I have the child sing it with me, or adult. I've used the songs for all ages. Repeat it back. So I sing the phrase, they sing it back. Then we practice it with different shoe tying devices and all of those things. It's a simple song to help them sequence those steps. Because for this particular individual that I originally wrote the song for, it wasn't necessarily a motor planning area of need. It was, we forgot the sequences halfway through of what we needed to do. We had the motor down. We needed the strategy to follow that sequence. So you can do that with any song. And you see this in early childhood all the time, right? Setting rules and expectations to song, transition songs, easing those things so you have that strategy for future retrieval. So if you're like, I sing all the time with my kid at home, awesome, great. You're probably creating secret musical mnemonics that you didn't even know, but you can use it for any skill. So if you have a specific area of need, you can make a song around it. I hope I'm setting myself up for success. Does anyone have like a little skill they could think of that they want to put in the chat of, man, I could really use a song for this to help my child follow through with these tasks? It shouldn't be a long sequence of tasks, maybe like 4 to 5 things, a sequence that they might need to complete. We'll see if anyone has one. I don't want to set myself up for failure, but I usually ask for a request and kind of make a song on the fly. Because you can do that too. The gestalts that I used in there, we repeated it over, under. Oh yes, brushing teeth. Kimmy, that's a good one. Ooh, and picking up your clothes. Ooh. What do we have to do with the clothes once we pick them up? I'm just asking so I can put it in the song. Putting on clothes. Ooh, putting on clothes is a long sequence. I'm gonna do pick up your clothes. Yeah. So, okay, all right. We do songs for everything. Awesome, perfect. You're embedding secret musical mnemonics in there. So this one I might do like, pick up your clothes. Where do they go? Into the laundry. That's where they go. Pick up your clothes. Where do they go? Into the laundry. That's where they go. So just where they have to be. If you want to be more specific, if it's a purple hamper, into the purple hamper, that's where they go. You know it's clean when the floor is empty. You know it's clean when the floor is empty. Ooh, someone put in a different question. That is another strategy. We'll get there. Haha, someone said, how can I avoid repeated squeezing of hands? That sounds like a sensory area of need, which we will get to. Yes, simple heads nodding. Yes, sorry, I'm reading the chat out loud and not just closing names. So many good things coming in. So right, it could be a strategy for feeding, for picking up the toys, same thing. Pick up your toys. They go in the white bin. Trucks with the trucks. Animals with animals, or just keep it really simple. If you're making a whole song, that's not going to help, but just being clear about here's what this looks like, here's where it goes, here's when you know you're successful, and you make it just short, simple. The Super Simple Songs YouTube channel is really popular for a reason. There's some strategies embedded in there. And the gestalts that I'm talking about in here are these elements of everyone loves super simple songs, of symmetry, so things that go up, da 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 da. So what goes up must come down, keeping it short, sweet, to the point, so it gets chunked in our brain. And if you can, make it catchy, right? You know your child really well, so sing something that they're, if they like pop, do it in a pop style. If they like rap it, chant it. You don't have to sing, but make it repetitive, clear, and to the point, so it gets encoded in the brain. I will say the follow through for cleaning up toys and cleaning up clothes is also that intrinsic motivation, executive function skill of, I know what to do. I'm monitoring myself in the moment. I'm persisting for the duration of the task, and I'm completing it. So even when you present this musical mnemonic, we might not follow through with that expectation. I just want to put that out there so you don't come to me later, Alyssa, I sang your put away your clothes song. My kid didn't put away their clothes. There's some other things at play there too. So that's the hard thing, is that this is a strategy that works for specific things in the moment, and then you might have to add layers depending on what's the root of that strategy that you're working on. So I'm going to go to the other area that I would say I get the absolute most referrals and questions about, which is music therapy for communication. And this is one of my particular favorite areas. It might be one of my areas of research. It's what I love to talk about, what I love to rock out about. Executive function skills, as I was just saying, is my other area of research. I'm doing a study right now on it. So that is my other jam. That's why I had to throw that in there. But we get a lot of parents calling that my child doesn't talk, but they sing all the time. And they're like, I think music therapy could help them. And 99.999% of the time, it can. And there are strategies you can use at home to support that. If there's not a music therapist near you, that can create a structured treatment plan for your child. So we work on both expressive and receptive language skills in music. And you might be saying, yeah, that's what speech therapists do. 100%. I am not trying to take a speech therapist's job. There are very specific things that speech therapists do that we do not do. However, there are very specific things that music therapists do that speech therapists might not do, because we're using the elements of music to structure that communication in a different way and access different neural pathways in the brain. There's a question in the chat that they say they're off topic, but I am going to answer it because it's a sad answer, and you already know what's coming. They said, is music therapy covered by insurance? In some states, yes. In the state of Illinois, currently, no. However, our licensure bill just passed both the House and the Senate. We are just waiting, and this might be dating it. Hopefully by the time this replay is happening, it's already happened. We're waiting for Governor Pritzker to sign our licensure into law, because the bill has passed all of the things that it needs to pass. Once that licensure passes, our hope is that we'll be able to provide music therapy in the state of Illinois billable through early intervention, billable through Medicaid, and then we'll be able to potentially panel with insurance companies. Insurance is its own beast. So when you get frustrated as parents, I hear you, I get it. You get frustrated that all these services aren't covered. It's not that any of these people aren't highly qualified or trained for whatever method of intervention you're looking for. It's just that the insurance companies don't want to pay more people. And that's a very generic statement. I don't know the inner workings of every insurance company, but it's really a challenge, but we're fighting for it. And that's something I can answer at the end when we unmute too. If you're curious about costs of music therapy and those things, we aim to make it accessible in a way that's supporting people that we really care about. As I said at the beginning, everyone on my team and myself included love what we do. We are here to support people and change lives through music. So if that means coming and doing presentations to help parents change their own children's lives through music, I'm here for it. I want to do it. And with one of my favorite things, communication. So we have strategies in music therapy for both speaking and non-speaking individuals. That is the other thing I get referrals and questions a lot about, is for people who are non-speaking or device users. Music is a means of communication that doesn't have words. So whether that's to work on mental health and self-expression, or work on motor skills, or work on attention, work on engagement, work on play, you name it, we don't need words to build that relationship, build that rapport, and build that connection. We're able to use music and elements of the music to foster that, to work on skills that are meaningful to the person and meaningful to them accessing their life. But the cool thing, if we do have someone who is working on speaking and working on vocalizing, is that music and speech in the brain have the exact same pathways. So we're able to work on developing language, articulation, fluency, rate of speech, and then social communication as well, intonation, you name it, we can do it through music. So you see in this picture kind of the elements of our body that foster communication. So when we talk, we're using all of these elements. When we sing, we're using the exact same elements. So if it's a matter of a mechanic breakdown of speech, of getting the breath capacity, of getting the intonation, of getting the resonance, the acronym I use is RIPRAF, R-P-R-A-F. So respiration, phonation, resonance, articulation, fluency. Those 5 steps for speech and singing are the exact same. So if we can work on our riprap through singing, which might be more engaging for someone, we can build their breath capacity, we can build their range, we can build their intonation, which might improve their overall level of intelligibility and articulation. The articulators we use as well, our tongue, teeth, and lips, move the same when we sing as they do when we speak. So if we're doing some articulation drilling for specific sounds, you can find a song that has that speech sound and sing it a lot. It's making the same motor plan. So you're still encoding and entraining those neural pathways in the brain, whether you're singing or speaking, and you're building up the strength of those motor mechanics of speech at the same time. So you don't always have to talk it. If you have a child who really loves singing, you can sing Baby Beluga 3,000 times a day to work on the bilabial buh. You have all those strategies in your arsenal. The even cooler thing about communication, which is the first one I said, is that when parents come to me and say, my child doesn't talk, they don't say sentences, they don't communicate often or independently in that way, but they do have the capacity to, they sing all the time. The great thing, this is where that hemispheric divide can be really beneficial to us. So it's the myth of the left brain versus the right brain. The reality of the left brain versus the right brain is the left hemisphere is where a lot of language is developed, right? Our areas, Wernicke's and Broca's area, these related extended networks in the brain that are associated with communication and language are predominantly in the left hemisphere. However, melody for singing is processed in the right hemisphere. So we use music as a means to teach communication on the left hemisphere. So what does that look like for you? This is the tricky one that might be harder to do at home, but I'm going to give it to you anyway and try it. So I'm going to give you 2 strategies because we have different communicators that sometimes struggle with these things. So the first one is using this concept of melody to speech. So the style in music therapy, specifically neurologic music therapy, this is called melodic intonation therapy. So it's a protocol that was originally developed for those with traumatic brain injury or stroke. If you know of the Senator Gabrielle Giffords, she worked with a music therapist in tandem with a speech therapist and the team at her hospital and outpatient care to relearn how to speak again after suffering a TBI to the back left side of the brain, which is a huge chunk of the left side of her brain. So she lost all language and ability to retrieve those words. What melodic intonation therapy does is we teach phrases through music, through intonation, so through the phrasing of music, and then we slowly fade away the melody to give that intonation of speech. And this is a strategy I use a lot with my Gestalt language processors as well, and maybe some research I plan on doing very soon to look at this protocol for our Gestalt language processors, because intonation is key. So one of the phrases they do in the NMT training all the time is, I want to go to the bathroom. So teaching that phrase of asking to go to the bathroom. So we're giving it a melody. I want to go to the bathroom. And then we're slowly going to fade that away. I want to go to the bathroom. 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 So you're teaching the phrase first melodically and then fading out the melody, which is the right hemisphere, to just the speech, which is the left hemisphere. Now, it doesn't happen in the 30 seconds that I did the example. It takes time and consistency of singing the phrase multiple times. So if you're trying to teach maybe a self-advocacy phrase or a requesting phrase or something tangible that really benefits this person's life, teach it through melody. And as they master it, take away the melody little by little. And that's the hard part, is you have to judge when that will happen. And that might be where a therapist could be helpful. But you're building those neural pathways on the left side of the brain from the right, because this is the coolest part of neuroscience research ever, is we have mirror images of these major motor network areas like Broca's and Wernicke's area from the left hemisphere. We have mirror images on the right side of our brain called homologs. So when we're building this pathway of the melody, we're activating those homologs. And when we're teaching it to speech, we're actually taking the pathway from back of left to front of left. Instead of doing that, we're accessing back of left. I heard the words. To right, I'm singing the words. I'm motor planning and singing those words out, front of right hemisphere, back over to the left hemisphere of I'm speaking the motor plan of these words. So instead of going back to front, we're sort of doing a reroute of the neural pathways. And that takes a long time. And I will be honest, it's not 100% effective for every person, because you have to build those neural pathways, and it's all about the extended networks and connected networks in that person's brain. And we know individuals with autism have differently wired brains. Some have overconnected, some have underconnected. It really depends on what synapses we're building as we go around, on how long it's going to take and who this might best benefit. But it's a strategy you can try. And at worst case scenario, you can try just teaching phrases that you need them to say in the moment to keep them safe, to ask for what they need. Teach them through music, because they're going to get encoded more quickly because of those gestalts and intonation for access, even during distress. And it's going to teach some of those speech patterns in the brain. The other strategy, right hemisphere is predominantly melody. And of course, there's some cross brain connected over, but rhythm is lateralized on the left hemisphere of the brain. So if you have someone who's struggling with the motor planning of speech, we have a protocol called rhythmic speech cueing. And this is what I use with a lot of my clients who have apraxia and autism. We're using rhythm to facilitate the motor plan of speech, because rhythm taps into our brainstem, to our cerebellum, and shoots up our premotor cortex, our primary motor area, and our supplementary motor area. Rhythm has neural networks embedded within there that naturally entrain to the beat. So when you hear a rhythm, your body naturally entrains to that. And this can be used for so many things. When we're dysregulated, our body naturally entrains to the rhythm we're hearing, for both speech, for motor plans, for breath rate, for heart rate. We can use rhythm to facilitate so many skills. So if I'm trying to facilitate that motor planning of speech, I might use a steady beat like this, where you can hear my pace of my words have changed a little bit with the rate of speech that I'm tapping on the drum. So that would be called metronome cueing. So we're sort of keeping the beat of a metronome. Or you can do syllabic cueing. I want to go to the bathroom. I want to go to the bathroom. I want to go to the bathroom. And you can do both together. So you have the syllables and the metronome of that steady beat going. So you're using the beat to encourage the words to come out, because you got that motor entrainment and priming going because speech is a motor plan to get the articulators and fluency going. So if you have someone who's struggling with the motor plan of speech, you can use rhythm to get it out. You can use a drum, you can use a table, you can use your lap, you can clap. You can also use a metronome, which is what I'm pulling up on my phone. There are free metronome apps all over the place. And this just sets the beat to get our brain organized and regulated and entrained. It's fuzzy, but it just says 80, which is 80 beats per minute, to get our brains and bodies moving with the beat, entrained and going for motor or speech or whatever you need, especially a tool for regulation, which we're going to get to next for my hand squeezing question from before. So that was a lot that I threw at you. I'm very passionate about communication. That's just called Metronome, that app. If you just search like Metronome in your app store of choice for whatever device you have, just pick whatever free one. It's nothing fancy. But that can even be used to organize a motor plan for emptying your backpack out at the end of the day, for transitions from one place to another, just to ease that, to get our brain up and moving. I will drop the spelling of it in the chat. I realize not everyone has degrees in music and probably doesn't know what a metronome is. Thank you. So a metronome is something you'll see traditionally in like music education, so that when you're practicing, you're playing with the beat. Instead, we're using that idea of playing with the beat for your body, brain, and everything to play with the beat and to play effectively. When someone said jingle ads, it made me think of this example too. When you walk through grocery stores, the type of music you used to hear was very slow and steady, or acoustic renditions of pop songs. And it's because the beats per minute, the tempo, so that's what 80 is, beats per minute. 80 is kind of like your slow walking, just regular, not slow, just your regular average walking tempo. So I find 80 to 90 beats per minute is the best optimal range, but it really does depend for each person. But the grocery store would play things at a slower tempo because you subconsciously entrain to the beat that you're hearing. So you start walking to that beat, you start walking slower, and you buy more things. So other people use our music therapy research for capitalistic gains as well, which I find very interesting. So we're going to move on from communication, because I just taught you all these things. Singing and speech are performed the same way. I will send you the PDF so you have all those things. And we're going to go a little into, I'm actually going to skip right to regulation. So the number one strategy I'd love for you to take home is this use of rhythm, because rhythm can do so many things, right? Like I said, it can decrease our heart rate. That tempo you're setting when someone's really feeling fast in their body and they're moving quickly and they're losing their spatial awareness and their safety and regulation, a steady tempo on the drum or with a metronome paired with like a relaxing, calming song naturally entrains their breath rate and heart rate. I'm not saying it's the cure-all, but it's a strategy you can use in the moment. And just slowing down, listening to the beat, just listening to the beat. That's one of those things in the moment as a parent that when you're getting dysregulated and your child is dysregulated, it's a strategy too that I find you can put your energy into so you can really get yourself back to baseline, so you can facilitate that co-regulation. Because we cannot regulate a child if we are dysregulated ourselves. So it's a strategy where we're both sharing and entraining to that tempo and connecting and down-regulating with the beat. And it's a strategy that's heavily researched as far as the heart rate and breath rate decretion. It's a strategy we use in hospitals for pain management, for our clients and patients who are having a really challenging time managing themselves. We play music, we use that tempo, we use those auditory cues to facilitate that internal response. The word we use in music therapy, it's a crazy word, external oscillator, to match your internal oscillator. So if someone's spinning fast inside, I might match it a little bit to go kind of at their tempo. So I've got those sub beats in there to match them. And then I'm slowing down slowly decreasing. So I match them where they are, I match them at their internal oscillator. And now that we're there together, I'm going to slow down and regulate with them. So it's a strategy you can use, and it ties right into the one that's on the bottom, the ISO principle. So this is a strategy we use in music therapy that is defined as meeting someone where they are and supporting them in down regulation through music. So we do this in person, and it's a lot of responding to the psychomotor regulation and what we're seeing from the person, co-regulating with them in tandem and coming down. But I do feel this is a strategy that's accessible to all, and some people are doing this and don't know that's what they're doing because we like to add terms to things that everyone uses. But you can make a playlist. So when your child is in a heightened state, you want to choose a song that kind of has a faster tempo to meet them where they are, and then build a playlist down to where they want to be or where you think would be best for them to be safe and regulated in their body. So you're building a playlist of a little quicker, coming down to maybe calm or relaxed or just okay, or from sad, a slow tempo, bringing back up to happy. You're meeting someone where they are with music that kind of matches that, which can be with the tempo. In addition, it can be with the lyrics of the song. If it's an angry song, I have a song called I Hit the Drum. When my clients are peeved, I'm not going to come in and be like, oh, you look so mad. I'm so sorry you're so mad, right? I'm not just going to do that. I'm going to meet them where they are. Oh, you're feeling that. Okay. All right. Oh, I see that. Hit the drum, don't hit your friend. Oh yeah, let it out. Hit the drum again and again. Hit the drum, it's easy to do. Hit the drum, I can do it too. Oh, we rumble when we wanna grumble. Oh, we rumble on the drum. So I'm using the tempo, I'm using the force cue of how hard I'm hitting the drum to safely get that energy out and bring us down. So I'll end the song with, hit the drum, I'm feeling better now. Hitting the drum, help me get my feelings out. Now I'm feeling cooler too, a little more relaxed. It's hard to do. Yes, this takes a lot of patience as an adult. Someone added in the chat. Absolutely. Hold on, I got to make sure we end us on the one chord or I'll leave myself unregulated there. It's really hard to do this as adults because what our expectation is for you is you have to get yourself regulated first. So this might even be a strategy for you when it's a hard day of you have your ISO principle playlist. I call it playlists with principle for yourself of I'm on edge. I am about to lose it because it has been 6 hours and I cannot anymore. We have all been there. I see so many kids. I had 2 groups back to back right before this that were hard, and I had to get myself right to be here. So I'm not saying there's any failure in you as a person if you can't get there. Self-regulation is an incredibly hard strategy. And to help someone else regulate, you have to be good to go to do that. And that is really hard. So it's not just patience. It's really true, that brain-body connection of, am I in a place where I am able to help you? And if you're not, it might not be helpful to intervene. Now, sometimes that's not an option. I totally understand, but it might be better to give each other the space if able, because you can't support them if you're not supported yourself. And you have to make sure that's there as much as possible within construct of child and within your own construct. And this idea of self-regulation with these tools, I love to give these tools and strategies to the clients that I serve as well, so they can use them independently. But that expectation of self-regulation comes way down the line when we're thinking of executive functions, because self-regulation means you can monitor yourself in the moment, you can choose the strategy you need that's most effective, and then you can implement that strategy in a way that's actually going to regulate you. So those are 3 big steps. And those executive function skills come to fruition in our late teens and adulthood. For females, our full prefrontal cortex, where our executive functions live, develop around age 23 to 25. For males, the research that's coming out says it fully develops around age 27 to 30. So the ability to impulse control, stop, effectively decision make, problem solve, self-monitor, self-manage, that's a lot for self-regulation. And sometimes it's as easy as, here, squeeze this beanbag. That's great. That's a great self-regulation tool, but we still have to intervene a little bit and co-regulate a little bit to get there. But music can be a way for you to do that too, without words. So even if you're putting on a song of like, I'm not going to say anything because I'm going to lose my mind, let me put on this playlist, or let's just sit here and drum the drum and see what happens, because it can be a really safe and tangible way for you to help in that moment that doesn't necessarily take all of your energy as well. So with that, I have 8 minutes left for questions.